Okay. Hello, everyone. I'm Dr. Anderson, Executive Director and founder of TOVA Community Health. For all who do not know about TOVA Tuesday, please check out our YouTube channel at www.tovacommunityhealth.org to learn more about so many great people in our community that are doing wonderful things to make an impact and help our communities live healthy lives with purpose. And one of the many hats that I kind of hold is I'm a senior research fellow at Delaware State University, and my expertise is in sickle cell and sickle cell trait. And today I present to you my STRADA scholar, who is a pre-nursing student at Delaware State University, Khalia Williams. And Khalia has been with me for a year now and has done a wonderful job on doing research, learning more about TOVA, learn about sickle cell and primary care. And her project that she worked on was entitled Beyond the Game, Navigating Sickle Cell Trait in Student Athletes. And we wanted to present to you sort of like an ethical dilemma or what we think could come up with athletes that have to get tested for sickle cell trait. At least the NCAA recommends that as athletes be tested. Khalia grew up in St. Martin, Phillipsburg, St. Martin, and her hobbies are reading, listening to music, and working out. She has an interest in being a nurse because she has a grandfather that has a lot of chronic medical conditions and even has been a caregiver to him. So without further ado, I want to welcome Ms. Khalia Williams to TOVA Tuesday to talk about your project. You can go
Hello.
ahead.
Hi,
Hello,
everyone.
Khalia. How are you today? Before we get started, what prompted you or what invigorates you to want to go into the field of nursing?
Well, I always knew I wanted to go into the medical profession, and it wasn't until my grandfather, when he came to the United States just to visit us, and the lockdown happened when he started having his health issues. That's when my caregiver role actually started and what prompted me to get into the medical field. And just taking care of him, just doing like basic needs, like doing his medications. He has a left ventricular assisting device, so I clean his drive line. I used to flush his Milrinone bags, just doing all these things. It just it really wanted me to do more. It excited me. Plus, with the shortage of nurses in the US after COVID-19 hit, we need them more than ever. And I feel like I'll be able to make a great impact on the healthcare profession. And I'm just really excited to help others on their recovery process.
Excellent, excellent. Great. So why don't we get started? And if you can bring up your slides and you can go ahead and present.
Okay.
All
Okay,
right.
so like Dr. Nina said, the title of this project is Beyond the Game, Navigating Sickle Cell Trait in Student Athletes. So here is an ethical discussion. We have one scholarship left, and what athlete would the coach pick? So these two athletes have similar stats. They are close to the same height, have a normal physical exam, the same GPA, but both have completely different conditions. Athlete one has exercise-induced asthma. His airways narrow during physical activity, causing shortness of breath, wheezing, and coughing. And to stop these symptoms, he would have to likely take his prescribed bronchodilator, slowing down his breathing or removing himself from the trigger completely. Athlete 2 has averaged 2 more points in high school than athlete 1, but has the sickle cell trait. His symptoms can include muscle pain, respiratory complications, and more exercise-related injuries. However, he could also be a case where he is asymptomatic, having no symptoms of the trait. To relieve his symptoms, he would need to stop exercising completely, stay hydrated, and seek medical attention immediately. Though both of these athletes have health complications, I believe athlete one would be chosen for the final pick. Many people are unaware of how sickle cell should be monitored and how it can be prevented, how the symptoms can be prevented. And athletes would need to stay hydrated, not exert themselves too much, and more self-care and have more self-care injury prevention tips. Just like asthma needs to be regulated, the sickle cell trait should be the same. So I feel like the coach would definitely pick athlete one.
Okay, so let's put this in the context. You know, college athletic departments have budgets and coaches have budgets. You know, how many scholarships they can give out, athletic scholarships. And so we thought that there would be an issue or could come up where you have one scholarship left and both of them are equally have equal athletic ability. And we think, or at least Khalia thinks, that if there's two scholarships left and they can only pick one, Khalia, you think the athlete one would get chosen.
I definitely do.
Okay, you can continue on.
So here I'll be discussing potential sickle cell trait problems that can occur. So dehydration, kidney problems, respiratory problems, delayed bone healing, hypoxia, sickle cell retinopathy, and infections can all come with the sickle cell trait. Though not everyone has these symptoms, they can still occur. Student athletes should be mindful of their self-care training injury prevention tips to avoid these types of situations. For example, being outside in the hot sun and not drinking enough water, just pushing your body way too far can cause medical emergencies. And you want to try to stray away from these preventable situations because it could cost you your life. And students should know how to properly train to reduce the chance of being hospitalized or even dying from preventable conditions. So here are some exercise self-care tips that students can use. So symptoms of sickling can include muscle cramps, muscle weakness, shortness of breath, and dizziness. Some training tips that I could give them is to obtain a physical exam, staying hydrated, not overworking the body, setting their own pace, and not drinking caffeinated drinks. And if an athlete ever experiences these types of symptoms of these exercise-related illnesses, they should seek help immediately as soon as possible to prevent further complications.
Okay, I just want to stop here for 1 second just to share, and I want to get your feedback. So the NCAA recommends that athletes should get screened for sickle cell trait. If they don't want to be screened, they can sign a waiver, and then they're giving some information about the trait and safety tips with exercise. Um, do you foresee there would be an issue like, you know, athletes like myself, I ran track for the University of Delaware. I always pushed myself to the absolute limit because I wanted to perform the best that I could to be the best athlete. So even if it was a hot day or you know, I was doing 10 200 sprints with less than a minute between each one or with a resting period, I wanted to push myself to the limit because it was always in my mind that if I worked hard in practice and if I trained hard, then I would have better times when it came to competition. Do you think that that could be an issue with some of the college coaches and trainers, sort of having that mindset still?
Well, as student athletes, they are told to basically push themselves to the limits, to do your best.
Mm-hmm.
Come up to the plate and, hit that home run. We all
Mm-hmm.
want to do our best in the sport that we love. But at times, we also need to tell the students when to stop, to listen to their body. If you are receiving these signs and symptoms that something's not okay, hey, I'm having even if you don't have asthma, I'm wheezing, my muscles are stiff, they're cramping, they're hurting me, I'm becoming dizzy. These are all signs of needing to get medical emergency. So yes, we always want to push ourselves to the limits because this is a sport. Though if we're not even competitive with others, we're competitive with ourselves. So we want to try our best. We want to make our coaches proud, make our teammates proud. That is something that many athletes go through, but at the same time, knowing when to stop, knowing to tell your body to calm down, and knowing when to sit down and just rest, drink some
Mhm.
water, taking deep breaths, going into the shade,
Mhm.
setting a cold compress on your forehead, doing things like that, making sure your body is getting what it needs because our body is very important and it tells these signs is
Mhm.
telling us to stop. When our body is telling us, hey, you got to slow down, we have to take those into consideration.
Very true. Excellent. We can continue on.
So here are some of my recommendations moving forward. I believe all athletes should be tested for the sickle cell, not just any student that goes to university, but more specifically, all athletes. Though many athletes are afraid of discrimination, which is our second point. All athletes, not some athletes are afraid of discrimination. They're afraid that they're not going to be able to do the sport they love because they have this trait. However, it's good to know your status. Some athletes don't even want to know because out of fear, what are other people going to say? Out of fear that how am I going to continue living my life with this trait? However, it's still a necessary thing to do. Your coaches need to know how to move forward if you do have the trait. They're going to be able to implement these different initiatives to help you if you come up in a situation where you're having these exercise related injuries and illnesses. You want to have that support system with you. So I feel like all athletes should be tested. And we know some institutions like University of Delaware, you're allowed to sign a waiver if you don't want to be tested, but it's still good and you have to be mindful
Mhm.
of having the trait if you do and have to be mindful of what to do in the future if you're coming into a situation where you have to condition, you have to work out, you have to do this, that, and the third. And like I said, there is a risk of discrimination. Just like our ethical dilemma, if a coach actually did pick athlete one because athlete two had sickle cell, that is discrimination. All athletes should have a chance of competing. It doesn't matter what disease they have, it doesn't matter what condition they're in. They should have these, especially those two conditions, but they should have the chance of doing something they love, especially a sport that they love, especially if they're on a scholarship at an institution and this is the only way to continue their right at the school. So we have to be mindful of the risk of discrimination in institutions like that. All athletes deserve an equal opportunity. It doesn't matter what type of condition you're in, they deserve it. And
Right.
education is extremely important. Knowing if you do or do not have the trait is very, very important. Knowing what to do if you have it and making sure the people around you know, not telling everyone, but if you absolutely need to tell your coach, you absolutely need to tell the health center because they are going to be able to help you. Fighting that type of condition alone is not going to be great. I can't even imagine. So, educating students if they do or don't have the sickle cell, maybe implementing some courses on what to do and how to just work around those type of conditioning environments, working around those exercises, what to do if they're having those type of reactions, if their body is telling them to stop, what they should be doing. So that could be setting up these health classes just to get them more information, just to keep them more mindful of what to do if they have the sickle cell trait.
Yeah. Very good. I just wanted to just have you chime in on this because I'm a track athlete. Jackie Joyner Kersey, I don't know if you remember her. She was a world-class Olympian heptathlon athlete, and she had asthma, and she would had shared with the world about just learning how to monitor her symptoms, and being able to use her inhaler as she needed, and how she was able to adjust her training. And she was amazing out on the track field. They have a NFL defensive back named Gerard Powers, who we talked about in your paper, that played for the NFL for 8 seasons with the Arizona Cardinals and the Baltimore Ravens, Indianapolis Colts, just to name a few. Though he knew he had sickle cell, he describes when he was training or exercising that he was tired, or a feeling of tiredness. And when he tried to power through, and sometimes his symptoms got worse. And he used to think that he was out of shape. But sometimes workouts just really kicked his butt. And he said, I felt like I was dying. Um, he didn't know anything about some of the precautions, the safety precautions with exercise, perhaps adjusting how he trained, modifying his training. He said that could have helped him perform better. Can you talk about that?
I can absolutely can. So just like I said, how all athletes should be tested, every t- while I was writing my paper, every time I looked up some cases about sickle cell trait statuses in student athletes, it was always them not knowing their status. It wasn't until after they were being hospitalized, or even or after dying, that's when it actually confirmed that they did have the trait. So that's why I feel like he was having all those experiences not knowing that he had the trait, not knowing that him pushing himself could have really killed him. And just knowing that yes, just maybe doing the finger prick and saying I do have the trait and I don't have the trait, and it could give us some clarity, give us some relief. Even if the person does have the trait, they could go on and learn what to do before performing any type of physical activity. Is very important. And especially because I do have asthma and I performed a bunch of sports when I was younger. So I had to be mindful of my triggers. I had to be mindful of what could make me potentially like flare up, what can make me out of
Mhm.
breath, what can make me wheezy. And once I got those regulated, once I knew what to do beforehand, which is taking my inhaler, I used to take 2 puffs of my inhaler before gymnastics class just to prevent any type of complications happening. I even let my
Mhm.
coaches know, hello, I have asthma. So just in case at times I might have to sit out. I might have to sit down.
Mhm.
I might have to take a few breathers, maybe get some extra drinks of water, things like that. So it's just precaution, and precaution can definitely save lives.
Right. So just want to be clear that Gerard Powers knew he carried the sickle cell trait, but he didn't know of the precautions that he should take and some of the symptoms he could experience. But Dale Lloyd, the running back from Rice University, died doing exercise and training on a super, super hot day under sweltering conditions, died during training from exertional exhaustion, and his family was the one that pushed the NCAA to at least recommend that students get testing. Can you talk about the family of Dale Lloyd and why you think that all athletes should get testing? And I'm sure they probably want it the same as you did, but just the fact that they recommend that athletes get tested or know their sickle cell trait status is important, as you, yeah.
Right. And thank you for correcting me. And I just want to touch on that as well, how
Yeah.
though some
Okay.
athletes do know their status, they do not know the extent of what can happen with the trait. They're not,
Right. Yeah.
yes, I do have the trait, but they're not aware of what can cause the sickling, what can cause me to go
Mhm.
into to all these exercise-induced illnesses. So just knowing that they do have the trait as well and having the precautions to move forward, things like that. And I definitely agree with the family. So I did mention how all athletes should be tested. It's a safety thing for both the students and both the schools. Because if, let's say, an institution does not require students to be tested for the sickle cell trait, and then a student is admitted into the ER because they're having a flare, they're having a reaction from the trait, or a student dies. So who's going to be held accountable? Because the student didn't have to expose their status. The institution is going to be held accountable. So I feel like everybody should know, though it might be scary, though they might feel like there is a risk of discrimination, which there shouldn't be. There should not be any type of discrimination towards any sort of condition, but it's still important and it's still necessary for all parties to know just how to move forward with it.
Okay. So I just want to end on what is your experience with getting screened and tested for sickle cell trait? Tell me about your fears. Did you want to do it? Why did you do it? And once you did it, how did you feel?
Well, I will admit, before I even started interning with you, I didn't really have a general complete understanding of what sickle cell trait was. I couldn't even decipher what it was from the disease, from the trait. So after spending a lot of time with you and doing a lot of research and get to be able to fully understand what the trait was, I did want to see for myself if I had the trait, which I'm sure I would have known, but in many cases, a lot of us don't know. Yes, we might be screened when we were a child, but we don't carry that all our lives. We don't hold that in our mind all our lives. So it's important to, if you're doing anything, if you want to start, any type of physical activity, or just to know, you could pull up your medical records or just get that tiny little fingerprint. So of course you have those anxieties before, just because it's a little like prick, but I wasn't nervous. Not even about the results, because I knew if I did have the trait or if I didn't, it would give me more clarity. It would give me more understanding of my body, understanding of how to move forward. So, as Miss Leona was pricking me, I was just, when we did the drops, I was just waiting for it, and you have to wait those few minutes for your
Counting
results to
down,
come.
counting down.
Right, exactly. So it's just like, da, na, 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 like, yeah. So, and I was negative for the trait, but yeah, so I feel like it was necessary for me to know. It was necessary for me to find out if I did have the trait.
Very good.
And after, I've encouraged a lot of people to get tested as well. Just being able to test people at the basketball game was really exciting, really fun, and just helping people know their body, helping people understand if they do or they don't have the trait, and having the setup of what type of celebrities have it, and then because having the trait is it's not going to be the end of the world. It's You just have to have those precautions, because you could still live your life, do whatever you want to do, but you have to be mindful of what your body's telling you, and you have to be mindful of those complications that can come with the trait.
Right. Well, thank you so much. I think have done a great job. And I also wanted to share with the our audience that Khalia is also Miss Delaware State Honor Society. Is that correct?
I miss honors, yes, ma'am, for the
Okay,
2024
Mrs.
2025 academic year.
Honors, right? Yay! So she has the beauty and the brains, right?
Thank you.
So I wish you well at Delaware State University, and as you move forward in the nursing program, I think you're going to be a great nurse. You're a great student, and I'm sure Delaware State is excited to have you. So I want to thank you for joining
Thank
us
you.
today
Thank
on
you for
TOVA
having me.
Tuesday. This is brought in partnership with Delaware State University and TOVA Community Health. Go Hornets! I want to thank you all for joining us today. Remember, if you want to learn more about TOVA Tuesday, please go to our website at www.tovacommunityhealth.org or our YouTube channel, TOVA Health. Thank you all for joining us today. We have learned so much. All right, take care.
Thank
Bye.
you so much.